Outdoor activities like swimming and hiking are a great way to stay healthy. But they can also sometimes lead to rashes, sunburns, bug bites, and parasites. And one of them could be a leech. Hello and welcome to Knowledge TV Facts. Leeches are segmented parasitic or predatory worms that comprise the subclass Hirudinea within the phylum Annelida. They are closely related to the oligochaetes, which include the earthworm, and like them have soft, muscular, segmented bodies that can lengthen and contract. Both groups are hermaphrodites and have a clitellum, but leeches typically differ from the oligochaetes in having suckers at both ends and in having ring markings that do not correspond with their internal segmentation. The body is muscular and relatively solid, and the coelom, the spacious body cavity found in other annelids, is reduced to small channels. The majority of leeches live in freshwater habitats, while some species can be found in terrestrial or marine environments. The best-known species, such as the medicinal leech, Hirudomedicinalis, are hematophagus, attaching themselves to a host with a sucker and feeding on blood, having first secreted the peptide hirudin to prevent the blood from clotting. The jaws used to pierce the skin are replaced in other species by a proboscis which is pushed into the skin. A minority of leech species are predatory, mostly preying on small invertebrates. The eggs are enclosed in a cocoon, which in aquatic species is usually attached to an underwater surface. Members of one family, Glossophoneidea, exhibit parental care, the eggs being brooded by the parent. In terrestrial species, the cocoon is often concealed under a log, in a crevice or buried in damp soil. Almost 700 species of leech are currently recognized, of which some 100 are marine, 90 terrestrial and the remainder freshwater. Finding a leech on your body can be scary, but you don't need to panic. Following a few simple steps can help you calmly and safely remove a leech without any pain or complications from the bite. How to safely remove a leech. Your first step in removing a leech is finding it. If you spot a leech in your skin, check the rest of your body to see if any more have attached themselves to you. Once you find a leech, you can begin to safely remove it. Steps for removing a leech. The basic leech removal steps are the following. Number 1. Locate the head and mouth. A leech's head is smaller and slimmer than the rest of its body. Look for the narrowest part of the leech to locate its mouth. This is usually the part attached to your skin. Number 2. Pull the skin under the leech taut. Use one hand to gently pull your skin under the leech until it's taut. Number 3. Slide a fingernail underneath the mouth. Gently slide a fingernail under the leech's mouth to separate it from your skin. Number 4. Flick the leech away. Use your fingers to flick the leech away before it reattaches. Number 5. Clean the wound. Clean your wound with rubbing alcohol or a first aid cleanser to help avoid infection. Number 6. Bandage your wound. You'll see a lot of bleeding when you remove the leech. Clean the wound and then use a sterile bandage to cover it. Change the bandage frequently for the first few hours until bleeding stops. You can also try these alternative methods for removing a leech, using a piece of paper or a credit card instead of your fingernail. For this method, you'll follow all the same steps as above, but you'll slide a thin piece of paper or a credit card under the leech's mouth instead of your finger. Or, letting the leech fall off naturally. You can wait for the leech to detach itself when it's finished feeding, especially if you're having trouble removing it. Removing leeches from difficult locations. Leeches will sometimes attach to hard-to-reach areas, such as your ear canal, nose, or mouth. This can make it difficult to use the above methods for removal. If this happens, try one or more of the following. Use rubbing alcohol or hydrogen peroxide. To remove a leech from your mouth, gargle with alcohol or hydrogen peroxide for about 30 seconds. Swish the alcohol or peroxide in your mouth like mouthwash, then spit it out. Check to see if the leech comes out with it. You can also puncture the leech. Leeches can grow up to 10 times their original size when they're feeding. Sometimes, this can cause them to block an area like your nose or ear. Use a sharp object to pop the leech, killing it and making it easier to remove. What not to do. Do not remove a leech using any of the following methods. These can cause the leech to vomit blood into your wound and increase your risk of infection. Do not put the following on the leech: salt, fire, shampoo, and bug repellent. The medicinal leech Hirudo medicinalis, and some other species, have been used for clinical bloodletting for at least 2,500 years. Ayurvedic texts describe their use for bloodletting in ancient India. In ancient Greece, bloodletting was practiced according to the theory of humors found in the Hippocratic corpus of the 5th century BC, which maintained that health depended on a balance of the four humors: blood, phlegm, black bile and yellow bile. Bloodletting using leeches enabled physicians to restore balance if they considered blood was present in excess. Leeches have been used in medicine from ancient times until the 19th century to draw blood from patients. In modern times, leeches find medical use in treatment of joint diseases such as epicondylitis and osteoarthritis, extremity vein diseases, and in microsurgery, while hirudin is used as an anticoagulant drug to treat blood clotting disorders. Thank you for watching. If you find this video interesting, just hit that subscribe button.